Welcome to today's discussion. My name is Deidre Moss, and I will facilitate today's discussion. I am a PhD candidate, and today we will be discussing called the doctors, what's in the title. But before we get into that, we will introduce ourselves. As I mentioned before, my name is Deidre Moss. I am a PhD candidate from the Bahamas. My co-host today, again, is Miss Lisette Hawthorne, and I will pass the virtual mic to her for her to introduce herself.
Ah, I forgot that I had it on.
Talk it away. Yeah.
Yes. Okay, my apologies here. My name is Lisette Hawthorne Wilson. I am from Jamaica. I am a teacher for over 31 years at varying levels, and that is what primary, secondary, teachers college, and then now at the university college. I am assigned to the UA Open Campus program in Jamaica, and I'm also looking forward in participating in this discussion. So I hand it back over to you, Ms. Knotts.
Thank you so much. So there has been a recent debate over who to ascribe the title of doctor to. Some opponents say that the title of doctor should only be ascribed to someone who has concentrated in medicine or science, whereas opponents say that a degree holder is a degree holder regardless of their doctoral concentration. So as a result, the following questions arise. Does a doctor of medicine hold more value than a doctor of education? Should a doctor of education be called doctor verbally or professionally? Is a doctor of education degree just a piece of paper? So, for the purpose of this discussion, I looked at the definition of doctor, and the term doctor, as defined by the Oxford Dictionary, describes a person who is qualified to treat people who are ill and a person who holds the highest university degree. So there are various types of doctoral degree. You have doctor of philosophy, you have doctor of arts, you have doctor of education, so forth. But there are two types of doctoral degrees according to North Central University. One that is professional, which focuses primarily on application, and two, Doctor of Philosophy degree, which focuses on academic research. With that being said, we can get into our discussion. And the first point that I wanted us to discuss is to be offended or not to be offended. So, as an avid news watcher, I saw a debate on a popular international news station where the focus of the debate questioned who should or shouldn't be called doctor. After watching this debate and discussion, I considered my own position, and I thought about being in a position where someone would question the legitimacy of my degree, having not concentrated in medicine or science, but in education. And if anyone said that the title of doctor should not be ascribed to me, how would I react? Or would I be offended or not? These are questions that I considered, and I thought that this would be a great discussion among my colleagues and fellow PhD EDD candidates. Miss Lisette Hawthorne, what are your thoughts?
What are my thoughts? There are so many. Where Dr. Biden is concerned, when I did a bit of reading, realized that she has two masters and she has several foundations. She look out for women's health and think mental health and so on. Um, I don't remember if it was cancer also, but the point is, if this is a case where she has been working and publishing, and there's proof of her work and the worth of it. I don't see why, if she's being conferred a degree, why she cannot be called that, because it's not a case where she just sat down and did nothing and then she gained the name But actually, over the years, if you type in her name and do a search, if you do your own formal and informal research, you'd see that she has some amount of work of a high quality, notably between schools, because she has not only been stuck at one school, but she has been teaching at varying levels. And so I believe that if she has been given that sort of title, it's because of the recognition of the worth of work that she does. So why not give her that title? I just think that the conversation that they're trying to have based on the situation that is going on in the United States, they try to water down her achievements. But what say you, Miss Moss?
I agree with you wholeheartedly. I believe that if a person has earned the credentials, then present them with the title, ascribe the title to them. But that takes me to another point as well. Does a doctor of medicine degree hold greater value than other doctoral degrees? This debate brought attention to that question. Um, Consider, a doctor of philosophy or a doctor of finance or a doctor of education degree. When I try to understand the opponent side, I think that they would be taking into consideration the amount of time that a doctor of medicine has to invest into their degree to first study in their general studies area and then invest in their specialized area of content when that is placed in the balance with a doctor of arts. How can we compare the two? I also heard an opponent mention that in the case of an emergency and someone needs medical attention and you ask, hey, are there any doctors in the house? Are there any doctors available? And a doctor of education, for instance, says, hey, I'm a doctor. Can they literally offer any assistance medically? So what are your thoughts?
Let me give you back something. A teacher has fallen sick. There's a doctor's retreat at the institution where the teachers are. One teacher is sick. Can somebody actually walk into a room filled with doctors and ask, is there a teacher in the house? And none of them have that sort of credential. I'm just saying, if you're a specialist, you're a specialist. And if you are a specialist in a particular field and you're being called to serve, then you serve. If you're not, then you're not qualified. You understand? And qualification seems to be, we call it trans. I don't even know the term, but it seems to be movable according to who is having the discussion. But what I'm saying, I'm sticking to the thing that Mrs. Biden, Jill Biden, she should be called Dr. Biden. If they were to, we call it now, matriculate her years of service, it would be equivalent to that of a doctoral person. And I think she should have that title. That's
Thank
where
you.
I am.
Thank you for sharing. And so my final point, what I want to discuss is a narrative that I have seen on displayed all across social media, and that is a degree is just a piece of paper. So this debate over who should be considered a doctor reminds me of this narrative that I've seen a lot of people talk about. I've seen a lot of people post that in this whole scheme of things, a degree is just a piece of paper as compared to other qualifications that you should have. Years of work, dedication, sacrifice, discipline, sleepless nights, just a piece of paper. What are your thoughts?
My thoughts, one word, I'm Jamaican to the core, one word, bad mind. Bad mind. Only a bad-minded person can come up with that sort of narrative. A piece of
Okay,
paper.
what does bad mind mean? Sorry, I just
It's a kind of jealousy. It's like you have always been living in an era where everybody is at the same level. Everybody who's a walk foot or has a busted second hand or third hand car. Suddenly you, Miss Moss, or soon to be Dr. Moss, have acquired a brand new 2020 or 2021 BMW. God has blessed you with that. And all of a sudden, everybody start to look at you with squared eyes and looking sideways like a crab and say, is what she did to get that? It must be drugs. She must be a prostitute. Or she must be sleeping with a politician. Bad mind. Bad mind. You never work for it. You don't even know what the other person had done to get it. You don't know the sleepless night. You don't know how much of a loan she has, and you are envying. Well, it's the same thing. Someone who can come with a stupid narrative to say all sort of things about that setting. It's just a piece of paper. Do you know how much money went into getting that piece of paper? Bad mind.
That saying that struck a nerve with you. So let me just go a little bit deeper then. Let's say, okay, there's a job offering. It asks for certain qualifications, and you have someone who has the degree, but then you have someone who has the experience. So in that case, and I know it would be based on what the job would be asking for, but let's consider if you were in that position, how would you weigh it? I know it's a kind of vague question, but what would you value, the experienced person or the person with the degree and no experience?
It depends on the circumstance. It's a circumstance. Um, Everybody can have a master's degree, but do not have a particular experience to run a particular department. And that is basically the thing. So it depends on the situation of the job. And then you have other jobs that even though the paper is required, the experience is what is needed. Like for instance, special needs. I'm going to use you and I. You have a master's degree in special needs, but you have never taught at that level. You only have the theoretical foundation of it. Me, on the other hand, have had first-hand knowledge, 20 years of it. Who do you think is going to be more suited to fit into that post? The one who has the hands-on experience. The one with the paper cannot fit into that. And that is why I said circumstances, the situation that exists. And any good school leader would just look at the situation for what it is and pick the right person for the job. So, yeah.
So you said only those with,
Depends on the situation at
yes,
hand.
absolutely, absolutely. I've seen it before. Like I said, I've seen persons say, I have this experience and they chose this person just because they have a degree, and I've seen it before. But I would say cancel out. I know there's a better word, but that's the only word that can come to my mind at this time. But to cancel out everyone and say that a degree is just a piece of paper is kind of broad. But in the whole grand scheme of things, I understand that there are other qualities that should be valued, and other qualities that a person should possess to make them a more holistic candidate for a position. But to cancel out the hard work and sacrifice of persons who, make the sacrifice to pursue those academic qualifications is a bit of a stretch, if you understand where I'm
I
coming
have seen a situation where at a job, I was part of a panel, an interview panel where all the persons, with the exception of one, came in with the paper qualification. Looking at the experience, it's not there. Person was operating at a particular level and desirous of wanting to change. Here came a person with a certificate, but with years of experience. And what I saw the HR manager did is to strongly recommend the person with the certificate to have the job with the understanding that within a 3-year period, the person gets an opportunity to start upgrading process so that she can matriculate into the program, into in terms of the qualification, to be suitably qualified. Because when we asked her the questions, she knew exactly what to do, the whole steps and process, the blueprints and everything, checklists and everything. She knew the protocols, hands down. The others didn't have the sort of oration to articulate certain things. You could hear the textbook theory, but not the hands-on practice. So really, really and truly situation, circumstances. So in the case of being on that panel, we all agree that the person who had the certificate was the most qualified one for the job.
Thank you for your input. And to go back to our question of what is in the title, as a Doctor of Education candidate, when you obtain that degree, would you be protective of it, and defending the legitimacy of that degree? So would you want persons to ascribe that title to you?
You really want my honest answer?
Of course. Absolutely.
I'm a teacher. I want my students to still have that reach to me. I do not want to have a title be seen as a barrier for them not to come to me anymore. So for my students, I would not want them to call me doctor. They would be aware, but they still would know that I'm the same person. However, in the academic sense, I want my title. They want me to acknowledge their title. I want my title. Simple.
Thank you. You want your title, and I stand with you with that. So with that said, if there are any additional points, are there any additional points you would like to add, or are you satisfied with the conversation of
I am satisfied with the conversation. I just want Dr. Biden to be called what she deserves to be called. That's it. She has worked hard. Bad mind again supersedes the conversation of those naysayers who don't think she's suitable. But she is. And honor should be given to her.
Thank you. So with that said, I would like to thank our listening audience for listening to our discussion. I would also like to thank my esteemed co-host, Lisette Hawthorne, and I would like to, thank our viewers for listening in. So you can keep abreast of further conversations by liking our page, Can We Talk, to get future notifications for upcoming discussions. Thank you and good evening. Thank you, Lisette.
Thank you too.
Have a great evening.